Oh, welcome everyone to IsisParenting's breastfeeding webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, and board certified in pediatrics. I'm here outside of Boston, Massachusetts, sitting in IsisParenting's home office. We have 4 centers in the Metro Boston area. We have 4 centers in the Atlanta, Georgia area, and we have 5 beautiful brand new centers in the Dallas-Fort Worth area. So please come visit one of our centers or direct your friends and family to those towns and our centers if you don't live near one of those places. I, in fact, met Lexi and her 2 beautiful boys in the Dallas nest at the grand opening. So shout out to Dallas there. Okay, so today we are talking about an unpleasant topic, but one that most nursing moms will have to deal with at some point during their nursing journey. Blocked ducts is quite common. Clogged nipple pores, a little less so. In fact, a lot of people don't even know what that is. So we'll talk about what that is and how you can recognize or identify it and then how to manage it. And then we'll talk about mastitis, which fortunately is less common, but when it happens, it really can derail your breastfeeding experience and your entire week because you feel quite sick. So these things can be interrelated. Engorgement in the early days or over fullness just in general, and repeated fullness or engorgement could result in a blocked duct. Blocked ducts could result in a clogged nipple pore, which could happen independently of a blocked duct. And then, of course, mastitis. And mastitis can happen from an unrelieved blocked duct or an infection that occurs by coming in through a nipple pore, like a little crack in the nipple, perhaps. And sometimes mastitis happens with no infection. It's just an inflammation. So we're going to start with a tiny little anatomy lesson and understand why and how these things happen, and then we'll talk about how to prevent and treat them. And blocked ducts really are common. They can be kind of mild, where you might feel like your breast has a little bit of a bruised sensation, or you may notice a firm area or tender discomfort, may look a little bit pink. And a blocked duct is really what it sounds like. The breast tissue itself is made of milk-making gland, and an area of the milk-making tissue is not able to drain properly. And so the milk ends up backing up into the tissue, creates inflammation and pain. And sometimes the area will feel warm, look pink, and so on. It's usually one-sided. It may be recurring. You may get a blocked duct in the same area, in the same breast over and over, and we'll talk about why. That might have to do with, for example, your sleeping position or the way you wear your laptop bag on your commute on the train in the morning. Blocked ducts don't always advance into mastitis, but we do want to take care of a blocked duct promptly and try to resolve it because, number one, it's uncomfortable, and number two, sometimes it can proceed into mastitis if it doesn't get better on its own. In terms of mastitis, a Latin lesson for you, anything that's itis, itis, that means inflammation of in Latin. So essentially appendicitis, inflammation of the appendix, gingivitis, inflammation of the gums, that's what your dentist is looking like. And mastitis means inflammation of the breast. So the mastes are the breast tissue. And that doesn't mean an infection necessarily. It can be inflamed, warm, and tender and swollen without being an infection. So for example, your sprained ankle may feel warm and be swollen and sore, but it's not necessarily infected. Sometimes the same treatment, an antibiotic, even though there may not be a bacterial infection involved, an antibiotic can actually also have an anti-inflammatory effect. In terms of mastitis, it is more common to get mastitis in the early weeks of breastfeeding, and especially if there is nipple damage. So if there's a crack or a blister or an opening from the nipple, that is an easy route for a bacteria to enter the breast tissue. Less common, but again, another potential issue would be if an older baby is a little nippy and bites the nipple and makes a cut or a slit. And in the early days of breastfeeding, mastitis usually has infections that are hospital acquired, and then after 3 months or so, the infection is a little bit different. But there are typical antibiotics that are prescribed, and these antibiotics are safe to use while you're breastfeeding. You would treat a blocked duct and mastitis essentially the same way, which we'll review now, and the difference is that the mastitis, we usually do add an antibiotic to that mix. But looking at the anatomy of the breast, all of these images make it look so neat and tidy so that you can see the milk-making tissue, and then it all drains into this duct, and then the duct comes out the little pore of the nipple. And so, if the breast is firm here, then it's backing, the milk is backed up into this duct and so on. And people will say, oh, if there's a blockage in a certain area, then nurse your baby in a certain position so their nose and their chin are pointed this way or that way. And it makes it look pretty simple to figure out where the blocked duct is. And in reality, it's not like that at all. So here you can see it's all neat and tidy and orderly, and everything is draining symmetrically. And in real life, no, everything, it looks like a snowstorm in there. And my analogy is that it is essentially like a bowl of spaghetti. So you have milk-making tissue here, and it may have a duct that drains all these different which ways before it exits through the nipple. So instead, your breast is more like a milk-making bowl of spaghetti where the drainage is convoluted, and then the nipple head is kind of like a shower head that there's 8 or 10 or 12 little openings, and that's where multiple ducts drain into and the milk is released. Now, a clogged nipple pore, the analogy is that they're nipple pores. And if a nipple pore seals over, the milk can't escape through other pores because it's not open back there. Each duct each duct maybe combines into several ducts together and then leaves through a certain pore. So if one particular pore ends up being sealed off, the milk is not going to be able to go anywhere, and then you will have that backup. So a clogged nipple pore seals off the opening of the nipple, and then the milk backs up. So it is both a combination of nipple pain and something that you'll see on the nipple, which I'll show you, and usually blocked duct. And sometimes they're partial, so sometimes they soften and resolve partially during a feeding, and then they recur. So in terms of a blocked duct, as I said before, it's not as neat and tidy and orderly as it looks, and you can't feel which quadrant of the breast is inflamed and know exactly how to position your baby to breastfeed. Okay, if you do have a clogged nipple pore, then you do want to treat that. It's also called a bleb, and blocked nipple pore, clogged nipple duct, bleb, all these different names for it. And essentially, there may not be anything to see on the nipple, but the best way to check for this is right after the nipple has exited the baby's mouth, or the moment you take your nipple out of the pump flange, and look for something that looks like a little bit of a whitish or yellowish white pimple, or like a white head on the nipple. And what that is the thick and congealed milk that is sitting in the tip of the duct, and then a little layer of skin has grown over it and has sealed it off, also called a milk blister, because that's what it is. It's like the skin has sealed over it. And why do I have Elmer's glue here? Well, that's my analogy. So imagine that your breast is like, or the duct is like a bottle of Elmer's glue, and the glue exits through the tip, and we all know that sometimes the glue dries on the tip and then it gets sealed over. And even if you've turned the orange cap so that the bottle of the glue is open, and even if you squeeze here really hard, until that glue, that layer is softened and then ultimately removed or open, nothing is going to come out the top. And that's what a clogged nipple pore is. So your goal with the clogged nipple pore is to, in a way that will not introduce bacteria or infection, you want to essentially open that milk blister or allow it to open. So some techniques that you can use to do that, I like the olive oil on a cotton ball approach. So just like it sounds like. You're going to put saturate a cotton ball with olive oil, put it over your nipple, put a bra pad over that, and put your bra up. And that can begin to soften the tissue a little bit. And hot soaks or warm soaks. You can put a soup bowl over the kitchen table and lean over it on your elbows and let your breast or nipple just kind of lean in there. Or you can use a hot wet washcloth and let that sit on your nipple. You can also use a hydrogel pad, and that can help too. So all of those things can help soften the sealed skin there. There are some recommendations that you'll find in breastfeeding books where they talk about using a sterile needle to open the clogged pore, and that can be very effective, but I would urge you to proceed cautiously because, again, it sounds a lot more painful than it is. You're not inserting a needle into the nipple, you're opening a blister, but you do have that risk of increasing infection, so you want to be careful there. But sometimes softening the skin, opening the blister a little bit, and then through nursing, pumping, massage, the blockage will clear. And sometimes you'll see when a block duct does clear, it will look a little bit mucousy or bloody in the milk. If you're expressing milk, you might see that in the milk, but not always. And then sometimes if it is a clogged nipple pore, you'll see some kind of thick, cheesy milk before the blockage clears. And that's just milk that's been sitting in the duct for a little while, and the fluid the fluid begins to reabsorb, and what's left is just the milk solids. Okay, so what causes all of these things? Any pressure or damage to the breast tissue itself can cause this. A tight bra, an underwire bra that puts pressure on the breast tissue. I'm not against underwire bras at all. If they're well fitted and you need an underwire bra for support, that's fine. You just have to make sure that it's not pressing on the breast tissue. You can see how this baby carrier here can be putting pressure on the breast tissue, especially if the baby gets really heavy and it's pressing in right here. So that, for some women that are prone to block ducts, could be a problem. And then how the straps of your your heavy laptop bag, things like that, if they press across your chest, that can cause repeated pressure, which, as the breast is filling, can create blockage. Very commonly, sleep position has something to do with it. So if you like to sleep on your left side and your left breast, the underside of your left breast is frequently getting blockages, well, maybe tuck a pillow underneath your arm and side so that you're not putting 3 hours of pressure on your breast as your breast is slowly refilling with milk again. Also, just make sure when you're holding or massaging your breast while you're breastfeeding that you're not squeezing too tightly. Anything that causes internal bruising. So say, for example, you're playing football with your 7-year-old and he throws the ball really hard and it hits you in the breast. Well, usually that won't be a problem, but theoretically, it could cause a little bit of bruising in the breast tissue, and that inflammation is going to put pressure on the milk ducts, and that then creates a block duct. Going too long between feedings, not pumping as frequently as you might need to, and sometimes that happens when your baby begins to sleep longer at night, which of course is a joy, but that often can lead to overfullness, and for some women, overfullness can lead to blockages. Another common reason for blockage is inefficient or poor drainage when you're pumping. So make sure that your flange size is appropriate. A common thing that I've seen are women that are using flange sizes that are too small. So when they pump, they get a little bit of milk initially, which is the milk that is released during letdown, but then they stimulate the milk to let down, but the pump is not removing the milk well. And so the milk stays in the breast, and ultimately, over time, they have that fullness and that blockage, or they need to press and squeeze because the flanges are too small in order to get the milk to come out, and that pressure of jamming the flange against your breast tissue can cause a block duct. And then some women are just going to be prone to block ducts in general because of the way their breast tissue is formed. Women that have really, really large breasts sometimes will have more issue with block ducts. And then if you had any kind of a breast biopsy or some breast surgery, sometimes just the way that your breasts, the ducts drain could be an issue for some women. But at any rate, whether we're talking about a blocked duct or the beginning stages of mastitis, the treatment is going to be the same. Heat, rest, empty the breast, add ibuprofen, and massage and compression. So that's what we'll talk about. And by the way, I forgot to give a shout out to Liz, who's here in the chat room today. And Liz, as many of you know, is an ISIS longtime friend and coworker here, and she's worked here in many capacities, and she just left a little while ago to have her second child, a beautiful little boy, and now she's back from maternity leave, and this baby that we're looking at is her first baby, who's now like 2 or something. She had her kids very close together, and I won't go into talking about that right now. That's a topic for another day. But she has these 2 beautiful little ones, 2 under 2, and here she is. So that's her picture, her baby, Isla. Heat, rest, empty the breast, add ibuprofen, massage, and compress. And so I have that caveat with a typo because I didn't close my parenthesis there. But cold. Some women find actually that heat before and cold after nursing or pumping is very effective. So just like you have a swollen twisted ankle, you elevate and you add ice. So that can help too. But I would generally start with heat before, and then you could try cold after. Nursing or pumping, and nursing or pumping, whichever is more effective and convenient for you. But frequent. You want to really be trying to get that milk moving. Add ibuprofen, as long as ibuprofen is a medication that your physicians have said it's safe for you to take. I would probably suggest 600 milligrams every 6 to 8 hours with a snack or a meal. And that serves as an anti-inflammatory agent, which can also help clear the blockage a little bit faster, as well as provide some help for the discomfort. And then here are the tricks. So the dangle feeding or pumping, get on your hands and knees, downward facing dog, and you can either arrange your baby underneath you and nurse in that position, or you can pump in that position. And for the dangle feeding or dangle pumping, I would suggest not having any bra on. So you really just want your breasts to kind of hang and free fall with no constriction. And while you're doing that, you can do that massage and compression. And then, as we love to joke on Twitter, a massager or a vibrator on the blocked area can be very effective. And you don't necessarily have to do that while you're nursing or pumping, but it could help. A hot shower and combing the breast. So you get in the shower and get your breast all soapy so that things are slippery and slidey, and then take a wide tooth comb or your fingers and gently, consistently, and repeatedly stroke from your rib cage down towards your nipple, all around the breast tissue. So that can really help. I call that combing the breast, doing massage and compression while you're feeding or pumping. And then for many people, lecithin can be very helpful, particularly for people who are prone to recurring blocked ducts or clogged nipple pores. And lecithin is something that you can find at Whole Foods or health food stores, and it's a food supplement. It is commonly, it's a fat emulsifier, and it's commonly found in dairy products that like to be smooth, like ice cream and milkshakes and things like that. It's also in a lot of bread products. It's healthy to take, but most lecithin is soy lecithin. So if you or your baby have a soy sensitivity or allergy, that's something to be aware of. It's hard to find lecithin that it's not soy based. Now, if you're doing all of these things for a blocked duct, and then you also start wondering if you're coming down with a cold or the flu because you have a headache, and now you're spiking a fever and you feel like you're going to puke and you just want to lay down and go to sleep, that's mastitis. And most of the time, a blocked duct that doesn't resolve and turns into mastitis, the sore breast comes first. But it also can happen that you wake up, or that as the day progresses, you realize you're getting sick and you feel very unwell, and the breast is not actually the biggest of your concerns. You may not actually notice yet that your breast is also sore. But anytime you have flu-like symptoms, and a high fever and feel unwell, plus a sore or tender breast. That's mastitis. So in other words, the breast may be the presenting symptom that progresses to feeling unwell, or you may just start off feeling unwell and then realize, oh yeah, by the way, your breast is sore too. Either way, that's mastitis. And although if it's very mild or very early mastitis, you may be able to stave it off with the ibuprofen, heat rest, empty the breast, add ibuprofen, etc. But for the most part, mastitis can make you feel really sick really quickly. And I would recommend calling your healthcare provider. And usually this would be your midwife or OB. They're the person typically that are supposed to be knowledgeable about your breasts, and they would be the ones that would prescribe the antibiotic for you. And then you continue doing everything else, just like we talked about, the ibuprofen, the frequent emptying, the dangle feeding, all of the things that you would do for blocked duct, you do for mastitis, with the addition of adding the antibiotic. Don't love to talk about abscesses, and abscesses are very rare, but I bring it up because it's something that we should talk about. And mastitis, recurrent mastitis, or mastitis that resolves or that doesn't fully resolve, sometimes an area within the breast can get sealed off and become a cyst or an abscess, which is essentially just a sealed off pocket. If it's a sealed off pocket of fluid, which is mostly milk, it's called a galactocele, a milk cyst, and that's not infectious and it's not a problem, but it should be identified. And if it seals off an area that's bacteria, then it's an abscess because it's, there may be pus or something like that within the sealed off pocket. And the breast may be tender and sore and red and so on. Typically, an abscess would be diagnosed by either a guided ultrasound. They would do an ultrasound to see if there's a cyst or if there's a pocket of liquid or semi-solid stuff in there, or they would do a needle biopsy, which sounds very painful, but actually isn't too bad. And if it's a milk blister, a milk cyst, they can actually drain it using the needle. But the reason I bring this up primarily is because lactating breasts are still breasts. And as women, we need to be careful with our breasts and make sure that any lump that's sticking around for a while is investigated. So although it's rare, it's certainly possible to have a lump in the breast, which actually is a concerning lump in the breast, even if you are breastfeeding. And some people may have 2 or 3 or 4 children over the years, and some people may be breastfeeding for a long period of time. You may have a 5 or 8 year period of time where you're having babies and you're feeding babies and toddlers and so on. And so my point is, don't ignore a lump in the breast. It should be looked at or addressed. And most of the time, it's going to be something that's not a big deal, like a cyst. But just like any other lump in the breast, it should be investigated. Now, I get a lot of questions from women who need help weaning, and then they have questions about what their breasts are like after weaning. How long are they engorged for? How long are they leaking? They can still manually express milk 2 or 4 or 6 or 8 weeks or months after weaning and so on. And a lot of women will say that their breasts feel very lumpy. So again, if there's a reason to have lumpy breasts, like I just weaned from nursing or pumping a few weeks ago and my breasts still haven't regulated, that's different. But I'm talking about a lump that's in your breast that's not changing over time. Okay, I think that's what I wanted to talk about. Yay! And keep your eyes on the prize, because blocked ducts and clogged nipple pores are a nuisance and a pain in the neck. And especially if you're somebody who is prone to recurrent ones, it's good to try to figure out, is there something that you're doing, a repetitive movement, a way that you're holding your baby, or to figure out, is there something that's preventable? To take extra care when you're pumping to drain certain areas of the breast, and shifting the angle of your nipple within the flange when you're pumping is a good way to drain other areas of the breast, just like nursing your baby in different positions when you're breastfeeding. And then clogged nipple pores, those can be recurrent and quite uncomfortable, and lecithin might be something useful if that's a problem that you're dealing with a lot. Okay, so let's see. We have a few questions. One I started off answering early in the chat room from one of our favorite twin moms, and she was saying that she's breastfeeding 3 or 4 times a day. She's pumping once in the morning, once in the evening, and she's pumping a significant volume of milk at those times. She would like to start weaning down that volume of pumping, but when she does not pump until empty, she tends to get blocked ducts and has gotten mastitis twice. So, what do I think about that? Well, the fact also is that you're making a lot of milk. You have twins. And I know that you're like, wow, really? I have twins. Oh, thanks for telling me. And so you're making a lot of milk, and your breasts are working hard. And mastitis is more common in women that are overproducers for a singleton, or women that are nursing and producing milk for twins, because there's just a lot of activity going on in the breast. So the fact that your babies are 8 months old, and congratulations, you've had mastitis twice, that's a bummer. But it's, it's not, I'm sure that other people in the chat room have had mastitis. But yes, and especially when you have 2 babies to take care of, it is not an easy thing. I don't know, though, if I would change things dramatically right now. The volume of milk that you mentioned expressing is a wide range, so it's either a lot or a whole lot when you're pumping twice a day. And I would probably, in general, suggest that you just pump a little bit less milk, or for a little bit less time, to very slowly and gently begin telling your body it doesn't have to make quite that volume of milk. But you say that you've tried that and have had issues with blocked ducts and mastitis. And so I'm a little hesitant to rock that boat. And I think I might suggest tackling the morning pumping session first. I think if you want to pump thoroughly before you go to sleep at night, I think that's probably a good idea. And I don't know that I would mess with that one. But since your babies are coming to the breast 3 or 4 times a day, and you've got 2 babies coming to the breast 3 or 4 times a day, I think that any extra fullness you have in the morning, they're going to help take care of during the day. So maybe I would tackle the morning pumping session and see if you can pump a smaller volume, or for fewer minutes, whichever way works better for you in terms of thinking about it. And then the boys hopefully will help reduce any risk of having overfullness during the day that could lead to an issue. Okay, next question. Here's a mom who has a 9-month-old and is interested in learning more about clogged ducts and nipple issues. Okay, well, I hope that that covered some. So her question is, if spending more than 3 hours or 4 hours away from the baby and not pumping, will it cause more clogged ducts? I've never been away for more than 4 hours, and I'm worried spending more time away will cause issues. So far, her 9-month-old is mainly breastfeeding with solids and only 1 clogged duct when you wore a sports bra. Okay, so as your baby gets older, your breasts get a little bit wiser, and when you have a 9-week-old, your breasts are kind of often overproducing. And if you skip a feeding because you decide to go out and get your hair cut and you don't pump, or you're gone for a long time, like 6 hours, your breasts are probably still going to be making milk, and you may get uncomfortably full or engorged, which may or may not lead to a blocked duct. But when you have a 9-month-old, it's possible. I think you could probably miss a feeding or be away for 4 or 5 hours, and you may feel full, but I wouldn't necessarily say that that's going to put you at a high risk for a blocked duct. And I think you just have to know, are you someone who's prone to blocked ducts? And kind of learn from that. And then you also say that you've been avoiding underwire bras, although quite large-chested, worried about changing bras, but need more support. Wear a large cup non-underwire bra. Yeah, I don't know where you live, if you're local to one of the ISIS centers, but you need to be fitted. You really should be fitted by someone knowledgeable to help you find an underwire bra that is going to be a good fit for you, not press on any breast tissue. But you could try that, and not only that, but you could try to get yourself a good underwire nursing bra. And then maybe start off by just wearing it for a short portion of the day, for half the day or something, and then switch to the bras that you've been using. And as long as you don't seem to be having any issues from it, I think that would be a good test for you. Oh, bummer. So you're local, but it's hard to keep the various sizes in stock, and sometimes you end up having to purchase specialty sizes, nursing bra sizes online. I'll have to look later. There used to be a great source online for not that you are plus sized, I don't mean to imply that, or large, super large, because nursing bras go up to A, B, C, D, E, F, F, G, H, I, J. I mean, there are some pretty big sizes, 48J, I've seen. So there are some specialty online real sellers that have bras in a variety of sizes, but make sure you can return them, which often you can't with nursing bras, because you really want to make sure it's a good fit for you. There are some bras that are still very supportive without being underwire. I like the Bravado tanks, and a lot of the Bravado bras are very, very supportive and not underwire. But I'm a woman who likes an underwire bra personally, and when I breastfed, I worked hard to find underwire bras that fit me. All right, let's see, 12:32. I've answered all the questions. No, I have one more to answer. And the guy from the tire place keeps calling me, and that's why I was distracted. Okay, this mom has a question. I have, knock on wood, I did that for you, a flawless 16-month of nursing your baby, but in the next few months we'll be working on slowly weaning. I've heard weaning sometimes lends itself to blocked ducts and other problems. Is this true, and what can be done to prevent it? You said yourself what can be done to prevent it. Slowly weaning. That's the key, really. And you can get a blocked duct any old time for any old reason, but really your best bet is to do your weaning gradually and let your body adapt. That's the best way to do it. So if you're at work, if you're pumping, usually I suggest beginning to decrease either or both the frequency of your pumping sessions and then the volume of milk that you express. If you're mainly nursing, then you would just be doing one substitution every few days or a week and let your body begin to adjust. So, and usually, by the way, the nighttime, the bedtime nursing, and maybe a pre-nap nursing and early morning cuddles, those are the ones that usually last longest in terms of a slow wean. And it's the daytime nursing sessions that usually you can distract your toddler from or come up with a substitute. And I do have a webinar that's on weaning by age, stage, and situation. And if you want to begin weaning, you may have to change your routine or your behaviors a little bit. So because in the home setting, certain activities or situations are triggers for nursing. So if you sit down on the couch to look at your iPad, that's when your toddler may come over and climb up and want to have a little nursey session. And so if your goal is to try to move away from that, then when you see her toddling over, you need to pop up and come up with a tempting activity like, ooh, let's go sit at the kitchen table and color. Or you need to shift the activity altogether and be out at the playground during the time that you're usually getting ready for cuddling and so on. Okay. Yeah, so I think we are all set. Oh, do I have a recommended baby carrier for folks who get blocked ducts a lot? Yeah. I'm laughing. She says, I have a Catan, a Moby, which we never use. It was a gift, an Ergo, and a Bjorn, which is best for the girls. And I took a minute there because I was like, but she's got boys. And she's talking about her girls. Yeah, in that picture of the Bjorn, you can see the straps pressing on mom, but that doesn't automatically mean that a Bjorn is a bad carrier and will cause blocked ducts. So I think you just need to look at where and how the fabric and the straps are hitting your breast tissue, and where and how the babies are being pressed against you. The Ergo, to me, always seems like a ergonomically designed carrier. It's good for the baby's hips. It's good for the baby in general. And it seems like there's, the straps are nicely padded and there's plenty of space there for the babies not to be jammed up against your boobs. But, I think any carrier really, if you're cognizant, every parent is built a little bit differently physically, so you have to just find the one that's going to be most comfortable and flexible for you. And if you see that you continue to get blocked ducts in a certain area, then that's where you want to just start to pay more attention. I think I've told this story before that I used to get a blocked duct often in my upper outer quadrant of my left breast, and I realized it had to do with being driving my car into a very tight garage, and the way I would open the door, but only could open the door halfway, the way I exited the car, I often would bump my chest up against the door. And so I realized over time that might be what was causing the issue. So I think, you just have to kind of pay attention that way. And another mom just commented that she loves the boba. Oh, and the back carry. Yeah, and a back carry doesn't necessarily mean it's going to be better for the girls because it's partly pressure from the baby and it's partly pressure from the straps. But yeah, I think as long as you're not creating persistent pressure on a breast that's slowly filling, you'll be okay. All right, what are we talking about? Next Tuesday, we are talking about the sleep program in the sleep webinar, and we're talking about, I think, follow-up, what happens in a follow-up sleep consult. And then next Thursday, next week here, I think we're going to do all questions and answers, and I'm going to introduce you perhaps next week to Melanie, who is another wonderful lactation consultant here at ISIS. And because I'm going to San Francisco at the end of this month, and I'm hoping that Melanie will do the breastfeeding webinar for me, for us all that week. So I'm going to see if I can get her oriented to this scenario. And there we have it. Okay, so Liz, thanks so much. And everybody else, thanks so much. And I will see you guys all on Tuesday for the sleep webinar and back here on Thursday for the breastfeeding webinar. Awesome. Bye-bye.